So here we see the Wagotrix system. Not only does it come with the sectional matrix bands, rings, and also wedges. So if we look inside, we see that we have a variety of 3 different sizes of wedges. Small, which is the white, medium, which is yellow, and the large. Notice the design of these wedges. It's curved so that when you put them in between the teeth, we're not puncturing the gingival tissue. And then there's these little ribs here that adapts to the surface of the teeth very nicely and creates a nice seal when using them in conjunction with the matrices and matrix bands. So if we take a look, you see the 3 sizes, and then we see the matrices, which come in a variety of different sizes. We have very small, we have a premolar size, a molar size, and then those cavity preparations that may be deep or subgingival. And then we see the disposable Wagotrix rings. These rings are intended for single use. You get several, as you can see in the pack with these. We have seen some people use them a couple more times or a few more times, but the beauty is they maintain their tightness, which is really, really effective. This close-up picture didn't come out that great, but you can see the curvature and the shape of the ribs that we use. So I actually will use these to even separate or prevent damaging the adjacent teeth. So we open up these teeth and remove all the decay. Here you can see the nice adaptation of the matrices, actually the whole Wagotrix system. So everything is clear. We have a nice seal, and now we can go ahead and etch, use our bonding agent, and in this case we're going to do a bulk fill for both restorations. So here we are using the phaser gun to heat the composite material. So what I recommend when doing this is you could do it as a 1 stage like this, but I like to add a little bit first, make sure I have my contact, and then add some more at the top. So I prefer to go with the C method or D method when doing these. It's a matter of preference. I think this method here is taking a lot of time in today's day and age with the materials that we have. I have yet to ever experience the B method. You can see there's multiple layers, or even the E method. So usually C and D are the ways to go. So if you look at the first preparation, we can see we did this as a bulk fill. And later in the presentation, I'll show you how I did it as a 2-stage. We see that using the Wagotrix, we have a nice anatomical contour. So I'm just going to finish these off and contour any flash or excess with the OptiDisc from Kerr. These are very nice discs that work very well. And the nice part is this area that snaps on is not metal. So if you touch the tooth, it doesn't leave scratches on that we've experienced with some of the discs before. Notice the composite restorations are all the same color, very radio opaque, thanks to the Wago fill. Well, over the years, I've used a variety of different sectional matrix systems, and you can see here sort of the differences in the different systems over the years. And I remember when we first started with the original ones, we would get some separation of the teeth, but there was really not an easy way to put the wedge into that area. This was a system that was available from overseas. It was a disposable type of system, but there wasn't a V shape to it. So when you try to put a wedge in there, it was very difficult. And as you can see, this sometimes would snap. For many, many years, I used the V3 system from Triodent, and it's a great system. However, over time, I found sterilizing this, it sort of lost its strength. And so I would have to go and purchase more over the years, or eventually this sort of coating would deteriorate with repeated sterilization. So my transition to the Wagotrix was really liking the V3 system and then going to something that's disposable. Look, we use a lot of disposable instrument or materials within our practice, paper products. To have something that delivers a perfect contact every time is something I highly recommend. And so notice the bulk here of the design of the Wagotrix, unlike something like this, doesn't break. And so it maintains that tightness, not only if you're going to just use it for the one time, if you want to use it maybe one or two more times, some people have, but it is intended for single use. But I know dentists always try to push the limit. Most importantly, you're going to keep that exceptional strength and you're going to get great separation because you get so many of these in the kit and they're very inexpensive. Notice the wedge creates a nice seal, and then obviously we have the matrices. Here you can see I'm putting quite a bit of force, and you can see how much tightness this has. One of the questions that I get all the time, you do get this forceps with the kit. However, if you have existing forceps that you've used for some of the other sectional matrix systems, like the V3 or some of them from other companies, they will work with this because this design is very, very similar. It's just enhanced for more better anatomical adaptation, and then also with these nice wedge designs. So this is what you get in the whole Wagotrix system, something that Kurt, I'm sure, will review the specials after this presentation. Okay, so let's take a look at another Class 2 restoration. I promise not only will I show a bulk fill method, as you saw with the two prior restorations, but in this particular case, you can see it was almost like a snake eye composite restoration. Notice this composite was not filled very well, so you can see over several years it's starting to wear down. Having a zirconium infused composite restoration, we're not going to see that. And look, this is what the trend is going towards, zirconium restorations. I'd say probably in the last 8 years, predominantly, I'd say 85% of my restorations now that are indirect are zirconia, and now we're finding that using the WagoFill, we're using zirconia infused composite restorations for our direct fill as well. If we look at the radiograph, we can see that the cavity has passed through the enamel to the next layer of the tooth, which is the dentin. So we're going to go ahead and prepare this. Again, we're not going to cross over to the other snake eye. We're going to try and maintain it here. We've broken the contact. We place our sectional matrix. What I recommend is now take a gold instrument and sort of burnish this to get a nice contact. You see the nice separation of the teeth. You see the wedge that adapts right into that V shape of the ring. And so we'll place our etch and then place our bonding agent of choice. And so in this case, we're going to use the C method, where we're just going to fill up, get the contact, and fill the proximal box, and then put another layer of the WagoFill. So there's no flowable in this. This is what it looks like. You can see we've placed that. And then we'll go ahead and use some more of the WagoFill and bulk it up. Cure this. Take our discs and polish. If there's any adjustment necessary in the occlusion, we'll go ahead and do that. And here we see the WagoFill, just one material, all radiopaque, being used for a Class 2 restoration with a nice contact and nice anatomical form. Now compare this with some of these other restorations that were done prior to this patient coming to our office. You can see the two different composite restorations. In this case, you can see they used the same composite restoration here, but they got a lousy contact. So using the Wagotrix and the WagoFill systems, we were able to get some really nice contours, and I feel confident that that material will last for a very long time because it's infused with the zirconia.